You are by far one of my favorite leading COVID experts. So thank you for carving out some time in your very busy schedule to let us know what is going on in this kind of unprecedented, scary time of the coronavirus.
Oh, thank you. Thanks so much for having me.
So let's just jump right in. We're in fall. This is the time of viruses, respiratory viruses. How do people discern if they have a common cold, they have COVID, they have walking pneumonia, something else going on? I myself just have gotten over a 2-week respiratory illness that was not COVID, but was tested multiple times for COVID just to be safe.
Right. No, it can be very confusing, especially even right now is also an peak allergy season in fall. So a lot of these symptoms are very similar, generally, if you are having a higher temperature, so what we consider a fever in medicine is over 100.4 or higher, then you should be worried about some type of an infection, whether that be a virus like COVID or the flu or even a bacterial infection. And you should probably go and be checked for both, actually, because flu season is also starting. If you don't have a temperature, then some of these things may be less likely, but other common symptoms, with COVID, flu, any type of virus can be body aches, fatigue. You can have stomach upset, like nausea, vomiting, diarrhea, loss of smell and taste is a common one. So again, if you have any doubt, even with milder symptoms, we're actually recommending being tested because especially in those who are fully vaccinated, sometimes the symptoms can be very mild. I saw a patient a few weeks ago. She was shocked that she tested positive for COVID because to her, she thought it was her regular allergies. It was just a little post-nasal drip and congestion, but she was like, let me be on the safe side and get tested. And sure enough, it was COVID. So unfortunately, it can be very subtle and confusing. And when in doubt, just get tested because that's the safest way to proceed.
And how common would you say are the breakthrough cases? And breakthrough cases meaning people who have been fully vaccinated and are still testing positive for the virus?
Yeah, luckily they're not very common. And as more people get vaccinated, those breakthrough cases also decrease. So, in certain areas like, the tri-state area where the vaccination rates are pretty high, luckily, we haven't seen many breakthrough infections. And if we do see them, they're not very severe. So again, the vaccines are still protecting you against, death, against being admitted to the hospital, but those cases are around. And that's why it's really important. I know nobody likes it, but especially indoors, to still consider masking when you're around other people that you don't live with. Continue hand washing, keep distancing, because even these mild cases can spread from person to person.
And in terms of the season of fall, when you think about the Spanish flu, right, going
right.
back, these cases can peak. So are we looking at seeing a possible increase in COVID around this time of year?
Yeah, absolutely. Because anytime, when the weather starts cooling down and people are spending more times indoors, not just COVID peaks, but this is why it's also the biggest respiratory season for flu, RSV, even the common cold, because it's much easier for it to spread indoors. And more people are spending time indoors now as we start moving into fall and winter. So definitely we may see a peak, especially in the upcoming months. And so that's why it's even more important to be careful, especially inside.
Booster shots for people who are fully vaccinated. What exactly is the booster shot and when are you supposed to get it?
Yeah, so booster is kind of like I think a misnomer. A lot of people think the booster means that the vaccines aren't working or they stopped working, which is not true. All 3 of the vaccines in the US are very good still against death and hospitalizations. The whole point of a booster is kind of to be proactive, or a third shot, in that it basically will cover you so that when, let's say, you do get to a point where some of that immunity is waning, you're prepared, so we're trying to be proactive. Still, it's more just for mild and moderate cases we're seeing in those people 8-9 months after vaccination. We are starting to see a downward trend of antibodies, but it's not something to panic about because there's so much more to your immune system when it comes to vaccines. There's T cells, which vaccines help get immunized to fight. And those we think are still holding very good responses. And outside of antibodies, there's other cells that work and remember that immunity and will still spring to action if need be and still protect you from getting very, very sick. But the whole idea is to get ahead of it so we don't get to that point where that immunity is waning, especially given these new variants that are more contagious. Then there's a group of people who are immune compromised, which actually, even with the first 2 shots, didn't mount the same response that other people do, because either they're taking medicines for cancers or autoimmune diseases or other conditions that suppress their immunity. There's a lot of patients I treat that have underfunctioning immune systems that can't respond to vaccines, so they need additional doses. So there's various reasons for it, and it's more just to be proactive and protect people.
We're still in a time in our society where the vaccine is still divisive. People have very strong opinions, polar opposite opinions on the vaccine, pro anti-vaccine. We just had Nicki Minaj tweet something off the wall about, it's fine what she said about doing your own research, your own due diligence, but then kind of went off on this tirade. And there are some networks and opinion hosts that are globbing onto what a rapper, not a doctor, not a scientist, with any kind of specialization in COVID is saying, and using it, weaponizing it. As a doctor, what will you tell people who are trying to get their information about trusting people like an opinion host or a rapper, both who don't have medical degrees?
Right. So you should be getting your research and your facts from someone who's trained in this subject matter. So I wouldn't necessarily go by what a rapper is saying, or a musician, or an athlete even, on this topic, because they're not the ones that are studying it, right? They're not the ones that are researching it or have the years of education and training to back it. The fact that this has gotten even so much traction is a little bit sad, I think, because immediately that shouldn't be something that's newsworthy, right? I mean, if Dr. Fauci made a statement about the vaccine, then yes, that should be getting a lot of traction, or anybody else who has that career-long history of expertise. So absolutely be cautious where you're getting this information, because these are not scientists. These are not people who've gone to school for many years and had decades-long career studying these organisms. So, be careful.
And just to wrap things up, for those that are perhaps on the fence about getting their vaccines and are hearing these horror stories, what do you say in response to that? And these stories that are not necessarily substantiated in anything than hearing it from a third, fourth, fifth party.
Yeah, I think that's a good point that you made. 0 of them are substantiated. There have been no deaths attributed directly to the vaccine. Many of these horror stories, there's no proof that there was any correlation to the vaccine at all. But outside of that, what I say is, all of us really need to be far more afraid of the virus than the vaccine. We have over 650,000 Americans dead, millions dead. Now, the most recent statistic yesterday I heard was 1 in 500 Americans have died from COVID-19. So this is not something to joke about, Outside of that, even people who recover, I see patients on a daily basis that 18, 19 months later, their lives are not back to normal. They can't work, they can't go to school. Almost every organ system is failing them. They can't concentrate. They might need lung transplants or kidney transplants. And these were people who were fully functional, healthy people, prior to getting sick. So the vaccine is extremely safe. It's extremely effective in all age groups. It doesn't cause infertility in men or women, but we have seen the opposite with the actual virus. Yeah. So please go out and get it. Like I said, I won't preach something I don't practice. So I've had it. All of my family members and friends have received the vaccine because I care about them. I don't want them to be that 1 in 500 people not here anymore.
Well, thank you for joining us today and for your insight. Always so valuable. And we'll see you soon.
Yeah, thank you. Thanks for having me.